welcome to another MassMedic program. I'm Rachel Robinson, Vice President at MassMedic, and we are absolutely thrilled to have you joining us for another exciting Women in MedTech program. So if this is your first time joining us for Women in MedTech, I hope it's not. You've seen some other ones, but welcome. Thank you for joining us. And you can find all of these other programs on our Vimeo site. So you'll want to take a look at that and look at some of the other awesome programs that we've run in the last 9 months, especially. But I'm so thrilled to have this program. It's very near and dear to my heart. Obviously, Women in MedTech is something that the organization has been really excited about for a number of years and really pushing to try to get the voices of women and underrepresented communities amplified in our community. So that's what we really want to do, and that's what we're excited to do today. And our topic today is going to be focused all around outstanding women who are pioneering engineering teams. And I know many of you will understand what it is to be a female engineer. I know what it is to work with female engineers and the outstanding work that they do. And honestly, just the really inspiration that comes from working with a group of people that are so determined to make, in this case, outstanding medical device and pharmaceutical products get to the market. So I tip my hat to so many of the female engineers I've had the privilege to work with over the last 10 years. But before we get started, I wanted to make sure I said a quick thank you to the organizations that make this program possible. Our sponsors are not just our sponsors, but they're also our partners and friends. So quick shout out to the Mullings Group and Toxicon, Freudenberg, Zymedica, Metadata, and our sponsor who's specifically helped put this together today, Boston Engineering. And so Haven, I would love for you to take just a few minutes and tell us a little bit about Boston Engineering and then introduce our speakers, because you so beautifully helped me pull these program together and recommended to outstanding women.
Yes, I apologize. I have a barky dog. Of course, the UPS guy comes right as I'm starting this. But welcome and thank you so much, Rachel, for the kind words and the introduction. And thank you for joining us all today for the Women in MedTech event. I'm Haven Tyler. I'm a Senior Client Relations Executive at Boston Engineering. And honestly, as a strong advocate for female engineers, we're really proud to be sponsoring this event. At Boston Engineering, we truly focus on saving and improving lives. And that's really honestly one of the reasons we go to work every day. And it's really great to see such a virtual room full of so many innovative individuals today who, like Boston Engineering, are really enjoy solving, tough challenges. So today, I'm excited to say that we have two women who I consider to be sort of the epitome of the innovative spirit, Aisha Ow and Aisha Arzumand. Aisha is the Director of Strategic Projects at AngioDynamics. She's a medtech leader in innovation and strategy. Although I just learned, which I think is fascinating, Aisha once saw her future in conducting music. However, she's now found her niche in the medtech world. So I'm really happy that Aisha can be joining us today. And our second panelist is Aisha Arzamond, and she began her youth and education actually in Bangladesh. And her fascinating path led her to the United States for graduate work. And for the past 6 years, she's been innovating in medtech and is currently a senior device development engineer at Takeda. I'd also really like to thank MassMedic for all that they do to just truly enrich and grow our medtech community. So with that, I'll pass it back to you, Rachel.
Awesome. So we're just going to get started and jump right into what I've asked our two outstanding panelists to do is give a little bit of an overview in the beginning of their journey, share a little bit of tips and things that they've seen along the way. And then we're going to open up for Q&A. I have obviously some questions prepared and I can ask questions the whole time, but I don't think that'll be very interesting for everyone. So I highly recommend that you use the Q&A button at the bottom of the screen. Please send in questions throughout the program, and then I will make sure to ask those of our speakers at the end. So as I said, that's highly encouraged. Please feel free to make this interactive. We absolutely want to hear from you. You can also use the raise your hand option if you prefer to ask your question in real time. We can unmute you. So there's that option as well. So with that, I'm going to turn things over to Ada.
Well, thank you, Haven, for the very kind introduction. Now I have to speak about that part of my life. And thank you, Rachel, as well, for including me in this forum. It's very exciting, and I look forward to hearing from the other folks down on the other end of my computer screen as well. So my career path started very traditionally. So I got my undergraduate degree in biomedical engineering and my PhD in bioengineering. But during the time of my PhD, I realized my passion in music, and especially in conducting. I specialize in choral conducting. And after my PhD, I actually took a year off from my scientific professional life to pursue a professional degree in choral conducting in Boston University. So, and at that time I was thinking, well, the reason for doing that is not just to be a professional musician, but at the same time, what I want to do is to be able to teach in university. And I have this idealistic view that, well, I can teach both engineering and music at the same time, teaching the small university. And actually at the time that I was a student, I was actually not both, but I was a student at BU for conducting. I was a postdoc at MIT, but I was also an adjunct professor in one of the liberal art college teaching music. But one reality set in is that for a small liberal art college, funding is not always the most abundant. And unfortunately, the course that I have, the enrollment is not what they expect it to be, so it has to be cut. So that comes reality. It's like, well, that might not be a path that I can be pursuing if I need to put bread on the table. So I continue my work in both music as well as in science. And lo and behold, there comes an opportunity from a startup. It's a startup on drug delivery. So, and I was struggling as to, okay, should I pursue the startup career, or what should I be doing? And as I was struggling a bit, I actually have the opportunity to work with a world famous choral conductor. And we happened to share a cab ride to the Logan Airport. And he was like, well, you're really good in choral conducting, but I also heard that you are considering other opportunities. So I told him, and he said, you know, it's a gift to be able to use something that you love to let you pursue something that you love. So, and then he said, well, I'll just leave it as that, and then you make your choice. And I think that actually gave me the peace and comfort to go into the startup and start my career as an R&D scientist or R&D engineer. And it has been very interesting and very fulfilling at the same time. And that startup actually did not last long. I think I was there for about a year and it went belly up. So long story short, I joined a much larger company at that time. I also think that, well, maybe startup doesn't really work for me. So I should think about a larger company for my career. So I joined Smith & Nephew. And I started out as an R&D scientist and then growing in responsibility, leading projects and things like that. What I realized is that a lot of times project decision is not just based on the technology. So sometimes the technology works really well, but there are other reasons that it does not make to market, whether it's like commercial reasons or something as, I wouldn't say as simple, but it can be like clinical trials, that it's just hard to do a clinical trial to prove the efficacy of the device. So, and that got me really interested in other aspects of medical device. And I ended up doing a bunch of regulatory strategy type of things, as well as a brief stint in business development. And that's where I understand more about the commercial side of the medical device industry. So, and it's actually all these experience kind of lead me to my position right now. So my position is in strategy and innovation. So leading strategy projects, and it actually involves many aspects. And I love what I do because of that aspect that I can use like the different skills that I have and the different experience that I had from different positions before. So that involves basically trying to understand what, from commercial side, what the market opportunity is, what are the unmet needs, and then also from the technology side, what can the technology solution be in order to address that market need? And then what is the path that brings us from where the early innovation is to the bedside? And then mapping it out in a portfolio, basically. So that's kind of my professional life in 5 minutes.
That's great. Before we move on, I did want to bring up something that you mentioned, because you mentioned the startup went belly up, obviously, and you had the opportunity to see that so many things change and there are so many different factors. I often think that, especially early in our careers, and I'm sure this may happen for men too, but I think especially for women, when there's a failure or there is an opportunity that it's gone, whether it's our responsibility or our mistake or our decisions that led to that, it can really cause you to have a confidence crisis or a moment of pause where you think, okay, was I doing the wrong thing? Am I in the wrong profession? I would be curious, how did you keep yourself motivated to say, okay, maybe it's just a startup thing. Maybe this isn't the right perspective for me. Maybe I need to go do something else, and make sure that that wasn't something that affected who you were and your career trajectory.
Yeah, I have to say that I think what you said is so true, Rachel. Because I did question myself at those moments, and the startup went belly up is just one of my many crises in my life that I say, okay, did I make the right decision? Is it what I should be going into? And I think I was fortunate enough to have a community of professional friends that I can share with. I know we talk a lot about like mentors and role models. Those are definitely important. But for me, those friends and colleagues actually help me a lot. Help me see the different paths that are possible from it, and also help me network as well. And the network is not just like finding the next job, but to broaden my horizon as well. To see, okay, so outside of a startup or outside of drug delivery at that time, what else can I do? And I think that helps me understand that the medical device industry or medtech in general is much broader than I think.
Yeah, that's great. And I definitely echo that. And I think it's something we've heard in a lot of our past programs. I know we can talk, I think, for hours about this, but that peer network, right? Mentorship is sometimes looked at, I think, as this has to be someone who is in a senior position, who has in a role, it's more of a business mentor. I think oftentimes that's how we perceive it, especially in organizations. But there's something so organic and important about that peer networking opportunity, right? Those peer mentors who are in your community, in your network, who are friends going through similar things, maybe in different types of careers, but on the same career trajectories or paths or timelines. And I think that's really important. So it's great to hear that that was a really good factor for you.
Yeah. And I like what you said, it's organic as well. And sometimes the question that I have is, okay, so I have this question, like, whom should I ask? And I understand that not everybody has answers to everything. So it's like having a community, a peer network that say, okay, yeah, this question, maybe I should ask Rachel. This is a question for Haven. And that helped you. That's why I think that the network is very important.
Yeah, absolutely. Absolutely. Okay, we're going to switch gears a little bit. Aisha, I would love for you to share, similar to what Ada did, a bit of your story, and let's hear from you.
Thank you, Rachel. Good morning, everyone. I'm Aisha Arzumand. As Rachel mentioned, I literally came from the other side of the globe. So I was born and raised in Bangladesh. It's a country in Southeast Asia. So I was born in just a little bit of my background, so you guys understand my thought process. In comparison to United States, it's a more conservative society back there, right? And of course, I'm not from 60s or 70s, but I had my fair share of struggle as a girl in the society in general. However, I consider myself kind of being privileged because I grew up in a family where it was like my family was very progressive. Female education, I had every right to choose my undergrad major. Like I was never being pressured from my family on anything just because I'm a girl. So I feel myself fortunate for that because that's not the case for many of the other women back there, and maybe many of the women here as well. So I decided right after my high school, I decided to do engineering. And I joined like one of the prominent schools back in Bangladesh. And I chose my major as material science and metallurgical engineering because material science always seemed very fascinating. And I knew that like at some point, everything is cross-disciplinary, right? Like, and material science is one of the aspects that everyone uses. So I was like, that aspiration motivated me to choose my major. But my dream kind of shattered right after I graduated because back home, there weren't many opportunities to pursue as a material engineer, but my undergrad minor was in metallurgical engineering. So that basically means steel industry, ceramic industry, stuff like that. And when I graduated and I was looking at the job posting, even before I graduated in my final semester, we started looking at this. And I look at all the job posting and this says male applicants only. And I'm like, oh my God, I didn't realize that it's a very male dominating industry. And my department being one of the oldest departments in the university, that never like, I'm like, oh, it started back in 1958 and it's 2012. Like, of course, it's going to be a level playing ground. That's what I expected from my background. And then I'm like, okay, so what are my options? If I want to pursue my career in engineering, I have very limited options back home. And of course, I really didn't want to be like that roadblock. I didn't want that to define my career. I didn't want that to define my future. So of course, I applied for my graduate program in the United States, and I moved to upstate New York. So Bangladesh is a tropical country, and when I moved to upstate New York, and in December, it's like all white. And I am like, oh my God, what did I do? Because it's not only, it was a challenge for me to like literally cross the globe and come here. And it was not only the first time I'm living without my family, it's also like a different culture, different lifestyle, different weather, like everything was new for me. But luckily I got a mentor, my master's supervisor. He was extremely helpful throughout the journey. He understood me, my challenges, and he always came as a mentor who motivates, who guides, and give you like the directions that I can choose from, that this is not the end of the world. I took a challenge and I need to finish it. At the same time, my family was immensely supportive. So I think I gave total credit to both of these two groups, my mentor and my family, for being able to finish my master's with that emotional struggle. But so right after my master's, the other challenge came into play is my visa status. So as a foreign student, you get like an optional practical training period, which is like a 12-month period within which you need to find a job that pays you. Simple as that. Like I have 12 months, I need to land into a job, and I need to get a pay stub to renew my visa status. So I started talking early. I started networking. I started talking to international students who were about to graduate before me, that what are the path they're doing. And I got to know about like our university used to offer like a lot of opportunities. Like they had career counseling, they have job fairs, they have mentorship program, networking program, and stuff like that. I tried to take advantage as much as I could. I reached out to people, I connected with people, and it's not because that I'm asking them to give me a job. It's just to figure out that what's out there, what the network look like. And of course, it's that peer relationship that Ada mentioned about, that guides you towards like what, because I was in a time crunch. I didn't have the luxury to think about it and then choose one. But luckily for me, I landed up in a job in Massachusetts at a startup. Now in the retrospect, I'm calling it luckily, but at that moment it was like, oh, my bone crushing. Every day was a challenge. Every day was a roller coaster ride. But it was a startup, and it was a very small startup. It was literally a 15 people startup when I first joined. And like, we literally had 5 R&D engineers and huge load of tasks that needs to be done. And everything was supposed to be done yesterday. That was the timeline. So my 3.5 years journey at that startup was immensely rewarding now when I look back, because I worked as an R&D engineer, as a manufacturing engineer, as a human factory engineer. We had active part in the FDA filing, FDA responses and stuff like that. And I truly appreciate that journey. Other thing that I also think was very motivating for me, because right after the first year, like right after we joined, within a year, we submitted our 510K for the device that I was working on, and we got the approval in 6 months. That was a huge milestone in my career. And like, when we went to the patient community to educate them about this device, I realized the unmet need. Like, there is this, and we used to work with pediatric patient population, and the parents struggle and those kids struggle. It was just an eye opener for me that, okay, I didn't land up in a job because I was in a time crunch. I did land up in a job that has a value, right? I'm making a difference out there. So that was very, very, very motivating. But after 3.5 years, I started realizing that what are the options out there, right? Like, it's the same journey you go through with the new project maybe. And our niche market was long-term implantable devices. So I started thinking about like, what is out there that I can explore next? And as I mentioned, it was a long-term implantable device for drug delivery. So I was talking with my manager back then, and he introduced me to his wife, right? It's just was like just a coffee chat with her that, hey, I'm thinking about this, what is out there? Because she is in the industry for more than 25 years at that point. And after talking to me, she, like, as part of our chat, it came out that, okay, if you're interested in drug delivery, so what's next? What's the other piece of the puzzle is the drug, right? So maybe see if you are interested in that. So that struck me, and I started applying for a position that works with combination product. That means the drug along with the device for delivery. So that's how I landed in the job at Takeda. For the last 3 years, I have been working as a device development engineer from the combination product side. And it's like the drug industry, the pharma industry is a little bit different than the device industry. So it's another new journey for me. When I started Takeda, I learned a lot, got to meet awesome, amazing people. And that's how I became part of this panel today through my relationship with Boston Engineering through Takeda. So that's my background.
That's awesome. That was great. Thank you so much for sharing. I love your energy too. And honestly, I'm going to take like a snippet of what you just said and make it our recording promo for MassMedic in the future, because I think when you're in the industry for, I don't know, and maybe I'm wrong, but when you've been in an industry for 10, 15, 20, 25 years, sometimes you kind of lose vision sometimes of the magic that you are making happen. And you're absolutely right. This is what med device is all about, and pharma, right? It's about changing lives. It's not about making money, as everyone sometimes jokingly says. There's money there, but it's such an opportunity to do things that make an immense impact on populations and communities. And I love hearing your story about that. And it's very motivating, and it gives you the sense of joy. So I'm just going to pause with that one and say, we might use that little snippet when we're talking about how great, MedTech is and why everyone should come work there as we start our outreach. But I wanted to bring up something that you mentioned in our pre-call, because I think it's a really big theme and a big topic. And Ada, I'd love for you to chime in on this too, about not letting yourself get stuck, right? And I think that's a real fear that everyone has at least one time in their career or another of, if I take this next position or I don't take this next position, or if I do this or I don't do this, I'm going to get stuck into a box. And this is going to be the box that my career is going to be in for the rest of my life. So I'd love for you to talk a little bit about how that was a motivating factor for you, and maybe ways that you kind of evaluated what that box is, where you wanted to be versus the opportunities that were right in front of you.
Right. So that one thing that Ada mentioned is about having trustworthy professional friends. I think that's very important. And like oftentimes we think like, oh, I cannot talk to my manager, or people who are senior to me, they might judge me, or they might think like, oh, like we are very preoccupied with other people might think. But I think when you open up with your questions, with your confusions, people genuinely like to help you. People genuinely share their honest experience with you. So for me, I have this tendency of asking questions. And sometimes, of course, I filter, as Adam mentioned, that this question might be for him, this question might be for her. But what I did in my career, I had some amazing women colleagues or peers, and I talked to them. And some of them was like, I just love doing technical thing, right? There is no right or wrong answer to that. And yeah, I just see myself being in the technical role for the rest of my career, which is fine. Some had very strategic planning where they want to see themselves in 20 years, sorry, it's 5 years, 10 years, 20 years. So I kind of like got snippet of people, make sure that aware of what's happening in the industry, right? That's also very important to find your aspiration. Like, for example, when I moved out of the medical device to a pharma company, I didn't know what to expect in a way that it's a different industry in general, right? However, I know what motivated me, because I am joining to learn the other piece of the puzzle, which I have worked for so long. Because for me, if it's a long-term implantable device for delivering drug, each medical company was getting stuck for the drug for approval as a combination product. And each drug company needs a device to market it, to file for the license. So I found that's my aspiration. I want to know what's on the other side. I don't know what would be my aspiration moving forward. I am still in search for that. But like at that point, that was what motivated me to make the jump. But of course, the peers that I shared my confusion with, they helped me immensely to figure out. Even like for me, I know at Takeda, we really like to evaluate where employees want to grow, what's their aspiration. And like I genuinely appreciate this culture that I can have a very open conversation with my manager that this is my goal, how I can get there. Like he advocates me to reach to my goal. So that's a very healthy practice, I think. But yeah, that like I'm really grateful to have amazing colleagues who always supported me and gave me honest feedback to my questions.
Yeah, I think I want to jump in a little bit as well. So one thing that Aisha mentioned is advocates. And I'm fortunate to have advocates for myself as well. So sometimes it's advocates and cheerleader as well. So I remember a time that it's not that I get stuck, but more is like I get myself stuck in the position. So I get myself into trouble. So I remember when towards the end of my career with Smith & Nephew, it's an orthopedics device. I've been working on orthopedics for the longest time and all that. And an opportunity come up in oncology. It's a great opportunity. I am actually motivated to join that company because as I look, I say, wow, during the interview process, I realized that, well, orthopedics is great. I love it, absolutely. But in oncology, the product really is life and death. It's like something that you make, it can cure a person, and it's really impactful. But I get stuck in the idea, say, well, if I leave orthopedics, would it mean that, well, I do not have the years of experience on my resume? Say, okay, yeah, I have like 20 years of experience in this particular field. I'm an expert in this field. And I talked to one, it's not exactly my manager at the time, but it's one of the senior folks within the company. And he was telling me, it's like, no, go for it. Go for it. This is something that you know that you like, or you think that you would like, at least give it a try. You're not going to lose anything. At least you will gain skills. And whether it's actual technical skills or it's like soft skills of leading a team, leading product development. So, and I truly think that without his support, I wouldn't take that position. And he actually helped me unstick myself from the thought that I have to be in a certain industry to get my tenure.
I love that you both mentioned strong male figures who helped you. Obviously, Aisha, you said your mentor at school was a male figure, and Ada, your boss was. That's fantastic, right? I think we all need to remember too that, you know, the community is there to support us. It's not just other women, right? You can absolutely reach out to all of your colleagues, and you should be reaching out and looking for guidance from mentors from every part of your career path and profession. And that this is something that is everyone has an opportunity in, right? And we can all be a part of. So that's awesome. I mean, my first mentor was also a manager who was a man. So it's something where there's an opportunity for all of us. And I think that's really fantastic. I wanted to switch gears just a tiny bit and talk a little bit about engineering, because we talked a little offline about, you know, engineering background, you know, engineering skills are very specific type of skills, but there's a lot of applicability in other areas. So I'd be curious, you know, where have you both seen your backgrounds really prepare you to take on different types of challenges that maybe you weren't expecting?
So for me, it's the whole journey, right? Because like any other major, it never, like, it gives you the basic, it gives you the theoretical knowledge, but the industry is very different than what you learn in a college. But it's basic. I don't have a PhD degree, but I often heard my friends saying that PhD is a journey, right? It doesn't matter what topic you're doing that. It's basically make you prepared to be able to do anything, to be able to solve anything. It's a mindset. It develops that. So I think that's the thing that as an engineering, not the educational background part of it, but as like right after that, like you can see, as you mentioned, like all of our mentors are male. The reason is because there aren't many female out there, right? I can talk about my department. I only had one female professor. So according to the probability, ending up with a male professor for my master's thesis was more likely. But I think it's the entire journey that made me more a risk taker, maybe, and also like having that mindset that just because I didn't have experience in that doesn't disqualify me. I can figure it out. I have that ability to be able to solve any problem that is given. It can be an engineering problem, and I might not be the expert, but I know how to reach out to people to make sure I find the right person to solve it. It's not all about me all the time. It's also about the cross-functional team. And just having that strategical mindset is very important for any industry to be successful, not only in your career, but also as a team, right? So that I think that's what I learned along the journey, that I don't have to solve all the problem. I don't need to know all the answers, like in terms of professional setting. All I need to know how to navigate things, how to find the solution. It can be from my brain or it can be my peer's brain, but like knowing that how to solve a problem and not being afraid or shy of from a problem if it comes as a challenge, I think is the key. At least for me, that's what works. And I'm never shy about reaching out for help. Like if I don't know anything, I think it also comes from like seeing so many experienced people around me. So I am very open, and I'm very open to ideas as well. So I think that also helped me navigate in my career, because most of the time I'm the youngest engineer in the room. So in order for me to be heard, I often ask for other. I am not like, I don't know what should be the pathway should be, but it also like learning from their experience. I might have one solution, but they might have something else that worked in the past. So not to do the same mistake and learning from your peers' experience. I think that mindset also helps a lot.
I really love your sharing, actually. And I think one thing that that I learned from my engineering is how to ask questions. And asking the right question, I think that's applicable to basically like all areas. And then one step after that is after you ask the questions, you get all these response. Like, how do you find what is true, what is applicable to your situation, and then come up with formulate your own solution. And I think that's something that I learned from my engineering skills. And part of it is also analytical skills as well. And from my experience, and that's really crucial in terms of whether it's like building financial model or clinical regulatory strategy. I think a lot of it is the strategy part as well as the analysis part as well. And all those are from engineering.
Okay, well, this one's going to be I'm going to be very blunt. What do we need to be doing better in medtech? I honestly I do think that as an industry, medtech has taken a lot of strides to try to make it a more inclusive workplace, to try to understand that there's no one type of person or employee. I think, obviously COVID has offered up a lot of opportunities for people to work remotely and really impact the way parents can be at home with kids, but there's a lot more that needs to be done. So I would be curious, from your perspectives, and this is where it'd probably be great for the audience to chime in with any Q&A or comments. What do we need to be doing better? What can we be doing better? And what are the opportunities that you see that we can be doing maybe as individuals or as a group?
Yeah, so I'm a mother of three, so I have 3 young kids at home. And I have to say that even though we have taken many steps to advance like women rights and all that within the medtech industry, bias are still there against women. So there are some tough times that I have experienced through my career. I remember there was one time, it was right after one of my maternity leave. I went back to the office during the first week. My manager pulled me into the office and said to me, it's like, well, Ada, I don't see the drive from you. What happened? I understand that you have a baby at home, but that shouldn't affect you. My boss has expected me to answer emails like over the weekend. So basically implying that he is expecting the same. And that really sucks. Imagine that I'm back to work just for 1 week. I'm still trying to figure out how things work and at home. And he also switched me out to another project, which I do not like at the time. And it's when the support comes in, it's really meaningful to me. And so at the time, there's someone within the company that I talked to him. He was like the lead for another division and the lead on the project that I was working on at the time. And I told him, and he said, well, we need to get you out of there. And he did, he made it happen. Eventually, I did not take the position because of other reasons, but he basically got me out of it. And it's that type of advocates that helped me at that point. And after that, I kind of tell myself, it's like, okay, so what can I do when I see someone in that situation? Like, I want to be that person. I may not be in the power, I may not have this power to create a position and then put that person in, but to provide the support to that person. And that is really meaningful. And one thing that I actually just joined a meeting last week, which is actually within my town. So somehow we discovered that there are a lot of women in medtech within the town that I live in, and we just gather at a pub and then talk about our professional lives, and then also understanding that most of us have a family, have kids to take care of, and what that struggle is, and how we can provide support, how can we just be peers, like we talked about earlier, to others. So, and I think that's something that I can start doing myself, and be a friend, be the person who can kind of like lift another person up when he needs to. And also, I would say, don't be afraid to share positive as well as negative experiences. One thing that I realized is when I share that to some of my professional friends, my experience of seeing this bias against myself or other women, actually a lot of us experience that. It's just that we didn't realize that, and I wouldn't say nobody talked about it, but it's rarely talked about. We love to talk about our successes, how our journey has been, but the negative part, we kind of shy away from it. And so, yeah.
Yeah, one thing I would like to add, what just Eda said, is there are two things. I often think that female are not very vocal about what they're feeling and what they need. And maybe I'm generalizing, but that's a trend I have seen among my colleagues. Like when I ask for something I need, I think 5 times, maybe more than my male colleagues. They just go and ask. That's something we need to adopt. We need to stand up for ourselves as well. If like, I think that's because Eda mentioned about the maternity leave. I have seen one of my colleagues, she was preparing to go to her maternity leave, and she was doing all these calculations here and there, how her project might be impacted and whatnot. And I'm like, you are giving birth to a kid. That should be your priority. Forget about projects. Someone will pick it up. But then she was also feeling that what if she might lose out, right? Once she comes back, if she's not given to the same project, is it a step back from her career? I think like we just need to find as female engineers, or like in general, how to advocate ourselves too, right? Like, what do I need? This is my expectation. I need to go for maternity leave for 6 months, but this is what I would expect when I come back. I know things are not going to be straightforward, but at least expressing that is a step forward, right? That I don't want to be in a position where I'm giving birth, taking care of a child, and also when I'm coming back to work, I feel like, oh, I took a step back and I missed out so much in the last 3 months. That one thing. And the other thing is also, we call a new term, it's called making allies within the industry, right? Because oftentimes we have like a MDCOE team, like Women at Takeda. And oftentimes we have these sessions where we share our struggles as women engineers, and we invite our allies to come and join there. And their feedback is like, oh my God, I have never thought about it from your perspective or from a female's perspective, right? Because it's just like social blind spot. If you don't know any better, if no one tells you or teaches you or pointed finger to the problems, you just think that the problem doesn't exist. So oftentimes we have seen like, they just didn't think about it because they didn't have to. They haven't seen their male colleagues going through the same struggle as their female colleagues. And often, like, unfortunately, it's true because we need to reach out to our male colleagues because there aren't many females, right? But if you look at a male colleagues that they call boys club, right? I was recently watching a show, they were using that term, like in the industry, is they go for other activities outside the work. And of course, they don't socialize deliberately with female colleagues as much. That's just a sad reality. So I think this professional allyship might bring up some positive change in the industry in general, so that at least they can see it from our perspective and maybe try to empathize with our struggles and be more supportive.
Yeah, I think both those things are incredibly important. I was speaking with someone recently. I've been working overseas a little bit and had the opportunity to work in a country that has a year-long maternity leave policy. But what I've noticed, having spent some time looking around, is that there are really no women in leadership positions. And when I brought this up to someone here, they said, well, oh no, there's equality. Women can take a whole year off to have a baby and they're not penalized for that. And I was like, oh, that's equality. Okay, taking a step back on that one. But it's exactly what you both just mentioned. giving birth is an opportunity that women have, and that's absolutely outstanding. You don't want to lose your professional opportunities because you've chosen to take advantage of this other opportunity. So how do, and I do think that companies have made great strides in allyship and in maternity leave and in making women feel super connected when they get back to the workplace. So I do think that the industry has taken a lot of steps in the very, very right direction. There's always more that can be done, right? And there's always the unfortunate examples that happen to almost every woman, where there's a moment that you just kind of step back and say, you know what, if I was a guy, they probably wouldn't have said it that way, or they wouldn't have said it at all. So it's just making everyone kind of aware and making sure that in the moment, you recognize that it's happened and you have the opportunity to speak up for yourself. It doesn't mean you're aggressive and yelling and throwing a fit. It means you can respectfully have the conversation and say, this is what happened and this is why it's not okay. So I think that's on all of us. You know, you see it and it happens. It's on you as well to say something for someone else. So that be that person for someone. Exactly, Ada, what you were saying. So we've got just a few minutes left, but we do have some questions from the audience that I'd love to go through. So the first one, actually, there's two around mentorship. So how have you guys been successful and have you finding professional mentors outside of organizations, or have all of your professional mentors mainly been in your organization?
For me, it's not within my organization, of course. I definitely try to take advantage of the alumni group that I belong to from my two schools. That's been immensely helpful. But also, I don't do it as much as I did in that 12 months when I was looking for a job. But I often seen, like, if someone's career aspiration motivates me, reaching out to them in LinkedIn, just ask for a Zoom session of 30 minutes. And to my surprise, many people said yes and no. So it's, I think, of course, the professional or your immediate surroundings give you a huge opportunity to choose your mentors. But in my opinion, I never thought that I should be limited to that, right? And as I mentioned, like, I even had coffee chats with my manager's wife as well, because I felt like her experience is very valuable and I can learn something from that. So yeah, for me, it wasn't within my organization.
Yeah, so for me, it just so happened, I didn't look for it that way, that the mentors I've had, they were in my organization, but both of us have moved on to other organizations. So I can think of at least two of those examples. So, and one thing that I haven't done very well myself, and I should get on it, is to have the mentor hold me accountable. So for things that I want to do, that is not just a chat or like maybe meet again in a few months, but to give him or her the rights to hold me accountable. Ask me a question. Well, you said 3 months ago that you're going to do this. Have you actually done it? I was like, maybe not. So that's something that that reminds myself of the conversation that we just had. That's something that I should get on.
Yeah, and that is very powerful, right? Giving them the opportunity to bust you on it, right? And having that kind of motivation yourself to say, oh, okay, someone's going to ask me about this. It's not just me. It's now I am putting it out there, and someone's going to kind of hold me to it. It's a very powerful thing. So let's see some other questions coming in. Oh yeah, are you guys mentors? Do you mentor other people? Or would you want to? Do you have any official relationship, mentors, or is it more peer networking and mentorship?
For me, it's more like a peer networking than mentorship. And I also think that you just said that's the mindset, like a mentor has to be someone with so much experience and what. I often get connected to my undergrad student from my schools. They reach out to me for questions. And so I found that as a peer networkship, but I haven't officially called myself as a mentor for anyone yet.
Yes, so I do not have any mentors, my mentees, I should say mentees for now. And Aisha was saying, that it's more kind of like a peer network, and like sharing what I've been through, like for any particular questions that people have asked me.
Yeah, understood. Yeah, I can't say that I've ever actually mentored anyone myself, but it's very much a peer networking opportunity. So
Yeah.
I would highly recommend that to anyone. This is a good group for that. We do have just networking sessions for the Women in MedTech group. You're more than welcome to come and network and try to connect. I would also suggest, if you're looking for a mentor, reach out and connect with me on LinkedIn. I have a very large network. I'd be happy to recommend people. I think your connections would also probably recommend people. So I would start putting it out there to the people that you know that you're looking for a mentor, and this is what you're hoping to accomplish, and use your network to help you find the right person, because we all know outstanding women, right? And maybe they're peer mentors or peer network for us, but might be a great mentor for where you are in your career. So I would say LinkedIn is a great tool. I know some people use it more often than others. Email also works too. So send emails, ask for things, but put your ask out there, and people will get back to you. Also a comment about someone who's had trouble kind of finding opportunities in the med tech industry. How did you both get your kind of first foot in the door? Was it through your universities?
For me, it was through my networking. I knew about this job opening to one of my mentors. So I think I also, like, when I was at that time, I also reach out to other people that how they're finding opportunities and what worked for them.
Yep.
This was an interesting one that I want to share with the audience, that one of my colleagues, right, at Takeda, she ended up in this job by literally reaching out to the hiring manager, or like she didn't know he's the hiring manager at the time, but she knew that he works at a division at Takeda that interests her. So she reached out to him over LinkedIn saying, hey, is there any opening position? This is my background, and I'm really interested to take any opportunities that you might have. And fortunately for her, there was an opening. She got an interview call, and she eventually got hired. So never limit yourself. Just, it's not only within those Indeed and the other job seeking websites. Just try to find out something new. Like, don't shy off from approaching people if you're looking for new opportunities.
Yeah, so I was thinking about for the jobs that I had and have, many of those are from networking. So one of those, actually two of those, I actually saw the position either on LinkedIn, or one of my first job I saw it on Boston Globe. But sometimes the job description doesn't tell you everything, what they are really looking for. And for one of the positions that I can think of, it's like I saw that position. I wasn't sure whether that's a fit for me. So I talked to some of my peers, and some of them would say, hey, talk to this person, and then talk to this person. And then eventually it actually led to the recruiter for that position that actually gave me a lot more information about the position. Say, hey, that is actually a much better fit than I thought it is, comparing to what I see in the job description.
Yeah, and I actually just responded to, I put my email in the response to that question, because I will say now is a great time to be looking for a job in MedTech. Actually, now is a great time to be looking for a job anywhere. The hiring market is incredibly active right now. So feel free to shoot me an email, connect with me on LinkedIn. We have our members giving us, I don't know, hundreds of opportunities pretty much every week. So we have a network of our members, which is, almost 300 companies. Please feel free to reach out to me, send me your resume. I would be happy to share that with our members and the jobs that are coming in. So do not get discouraged. Now is a great time. It might be the opportune time for you, and this is your moment. So don't be discouraged. Send the notes over and we'll get you connected. So that's just a little a little note there before we ask one more question, and then I will let you guys go because we only have 4 more minutes. Just a quick question around coming back from maternity leave. Any thoughts on how managers and peers can be more aware of, when to schedule Zoom calls, when people will be in the office versus remote? I think it's probably something we're all going to be working through together for the next year. And it's not just maternity leave. It's obviously everybody getting back into either a regular office setting or a part-time office setting, coordinating schedules with kids and work-life balance. So I'm just curious if you all have any thoughts on that.
Not coming back from maternity leave because I haven't done that. But in general, I think majority of the industry is shifting towards hybrid model. So where you are not expected to be in the office 5 days of a week ever again. At least I know my company is going towards that direction. But I also think it's more towards the company culture, right? And so some companies are more like, oh, you have to be online at 9 and you have to be available till 5. And other companies are more flexible. They don't care when you're online, as long as you're getting your job done, they should be fine. So I think it's sometimes it's not as much as on you or your manager, and also like the overall company culture in general. So yeah, I think like COVID taught us that we can be way more flexible than we used to be. So that's really a blessing in disguise, because of course we don't want a pandemic. But yeah, I have seen people being more flexible who were not in the past, and that traditional 9-to-5 mindset, 9-to-5 job mindset is changing. So that's a good news.
Yeah, so I think most, if not all of us in the industry are conscientious enough ourselves to get job done and all that. So the flexibility is definitely important for a lot of us, especially for moms as well. So thinking about maternity leave, I think allow your colleague to carve out time during the day to take care of themselves, take care of the babies and whatnot. And also, even if it's not maternity leave, kind of like broadening out that to everyone, it's like, well, allow everyone to carve out times during the day to run errands or pick up a kid and things like that, knowing that that person will be able to fulfill his or her role at other times, whether it's during the same 9-to-5 period of time or that it's beyond that. So.
Agreed. I think it's, hopefully pandemic has allowed us a lot more empathy for each other, right? And employees can be seen as human beings, not just employees, right? It's the reality of things. There's dogs barking, there's kids crying, there's errands that need to be run, there's dinner that's going to need to be made. And the reality is nobody's really quite working a 9-to-5 anymore, which is great. It gives us all a lot more flexibility to be productive when we're productive. So I hope that continues in the long term. We'll just have to see how that goes. But this has been such a wonderful discussion. I'm so thrilled to have had both of you on the program. So Aisha, Ada, thank you so much for sharing with us.
But thank you so much, Rachel. This has been great. And I hope what I share is at least a little bit helpful to the audience. But I will put my LinkedIn profile on the chat. So if any of you want to contact me, I'll be happy to talk.
Wonderful.
Yeah, thank you so much, Rachel, for organizing this and also for inviting me as a panelist. Mm-hmm. It was exciting sharing my experience. I have an unfortunate thing. I lost my LinkedIn account for whatever reason, but as soon as I open one, I will definitely share with you, so you can forward it.
Awesome. Well, thank you both again. And thanks everyone to joining us for this, and have a wonderful rest of your day and join us at another Mass Medic program coming up.
Thank you.
Well, thank you all.